Let's go ahead and get started. So, hi, my name is Shirley Liu, she, her pronouns with the Asian Pacific Institute on Gender-Based Violence. We're excited to welcome you to our webinar for Domestic Violence Awareness Month in order to share back some learnings, themes, and reflections from the past year and a half of some listening sessions, surveys, and other types of things that we've been holding to learn about our community's needs, the priorities of the AAPI community. This webinar will be recorded and we'll be sharing it on our website in case you want to share with other folks in your networks. And I think that's really all the housekeeping that I have. If you're not familiar with Zoom, you can go ahead and let me know, send a message in the chat, and we'll try to help you out here. And throughout the presentation, if you do have questions or reflections, or if you're thinking, I've seen a similar trend or something like that in my community, feel free to just let us know also in the chat, so and we can get a conversation going, or we can learn what you're experiencing as well. So I'm here with Cannon. There he is, also from API-GBV, and we are going to be taking you through some of our findings today. So I guess I should introduce myself. As I said, my name is Shirley Liu. I am currently in Richmond, California, over on the West Coast near Oakland. I'm the Resource Center Coordinator at API-GBV. I've been with the organization for, I want to say 4 years, but I think I need to start saying 5 years now because it's almost 5. And I am responsible for some of our technical assistance and training initiatives, webinars, parts of our communication and other deliverables, building networks and deepening relationships with our partners and allies. It's nice to meet all of you kind of virtually here. Cannon, would you like to introduce yourself?
Sure. Hi, everyone. I'm Cannon, and I work with Shirley, and I manage our Title VI compliance and language access work at the Institute.
I think Cannon is probably a familiar face to a lot of you. And we have our contact information up on the slide there. If you want to get in touch with us later, feel free to do so. So a little bit about API-GBV, or the Asian Pacific Institute on Gender-Based Violence, for those of you who may not be familiar. So we are a national resource center. We work to end domestic violence, sexual violence, trafficking, and other forms of gender-based violence in Asian American, and Pacific Islander communities. We are not a direct service provider, but we work with allies, partners across the country, community-based organizations, TA providers, systems, and other folks who are engaging with AAPI survivors of violence. We provide technical assistance, as I said. We provide training, resources, advocacy, and general support to uplift the needs of AAPI survivors, and also to build the capacity of all of those who work with AAPI survivors to respond in culturally responsive ways. And you can see our mission up on the screen there. So a little bit of an agenda before we get started. We're going to be talking about what we've learned from our community, and I'll explain what I mean when I say, our community. So we're going to talk about some top-level themes and highlights from our learnings. And then we're going to talk about, from these themes and highlights, what are some of our recommendations and priorities. And you can feel free to put any questions you have, as we're talking, but we'll also set aside some time at the end for Q&A. So pretty simple agenda today. Before that, I want to talk, pause for a second and talk about who is this community that I keep talking about that we have been learning from. So in short, the short answer, it's allies and advocates, like I said, providing services to, supporting or advocating for AAPI survivors of violence, or Asian and Pacific Islander, Native Hawaiian survivors of violence, for immigrant survivors of violence, or for AAPI communities. The long answer is what's captured on this slide. So API-GBV, as I said earlier, or I guess I didn't say it, works with over 160 direct service, culturally responsive service providers and organizations that you see on this map. The map is slightly outdated, so there's a couple that have shown up since we created this map. But these communities are community-based organizations providing services, and they're deeply rooted in their local communities. And we partner and we collaborate with national organizations, networks, TA and training providers like ourselves, with state and territory coalitions on domestic violence and sexual assault, with partners and stakeholders in systems. So that includes the criminal justice system, law enforcement, healthcare, and with other AAPI organizers. So these may not be gender-based violence or domestic violence focused groups, but cultural groups. They could be professional associations, universities, other organizations and other groups. So we, as a national organization, are really privileged to have kind of a bird's eye view of the field of this work. And we see it as a big part of our mission to synthesize and to amplify the information that we are able to gather as a result of all these partnerships that we have, and to bring this information on AAPI needs to national conversations with funders or policymakers where we can. So all of our staff, learns from the community throughout their work, just as a regular part of what we do. But for instance, when we're providing technical assistance to a shelter, or out attending a conference, talking with advocates, between the sessions and so on. But some of you may know that our organization recently went through some pretty hefty transition in the middle of 2020, basically right when the pandemic started. It was a pretty interesting timing there. Our founding executive director, Chick Davy, who made huge splashes in this movement, and who's really guided our ship at the Institute for over 20 years, retired. And Zoom and online communication being so normalized nowadays, and so more widespread and easy, has really given us the opportunity and the impetus to more intentionally seek feedback from our community in a more structured way, and to think about where we can best put our resources and energy moving forward. So we sought to learn recent trends around, where there's still gaps, how has the pandemic impacted our community, and so on. And so that was 2020 and 2021. Here's a couple of the initiatives that fall under that, I guess that project or that goal. So this is my fanciest slide, the only one with animations. So we started with a community needs survey in October of 2020, last year. This was a written survey, SurveyMonkey. We collected responses from 25 AAPI direct service agencies, from TA providers and coalitions, to understand how our work, our resources, our technical assistance and training can best serve the community. And then in March of 2021, we had 2 virtual group listening sessions where we reached representatives from 11 community-based agencies, 3 state and territory coalitions, and 5 other partners, including educators and consultants, really seeking to understand, again, what are some of the trends in the community. That was followed up by some one-on-one dialogues with key partners, to really do a deeper dive on some of the issues that came up in the group listening sessions. We talked about data collection, we talked about trauma and mental health, and reaching particular groups of AAPI communities and AAPI survivors. And then lastly, just last month, we held a virtual listening session to inform the development of the White House National Action Plan on Gender-Based Violence, provide recommendations to the White House Gender Policy Council, the White House Initiative on AA and HPIs, on what the priorities for our communities are and what that plan needs to include. And so some of you on this webinar today may have been a participant or a contributor to one of these sessions or more of these sessions. And so a big thank you if you were, and we'd like to, obviously continue having these conversations with all of you. So throughout this time, of course, as I said, we do continue to collect information via our ongoing relationships and conversations with our partners and community members. So I'm not gonna read through these slides because I think I've already given all the info in the previous one. But just a couple, more snapshots of those particular sessions. So coming now to the meat and potatoes of today's call. Here we're going to be going over some of the trends as far as challenges that we've heard over and over again from the community. And we're just going to go over them in kind of a top level and broad way, but feel free if you do have information that you want to share related to something, or if you have questions, to put them into the chat or the Q&A, and we will do our best to address them. Okay. So this first one, over and over again, we've seen that there is a critical lack of data, and that means disaggregated data on AAPI communities. And we're always stressing how diverse the A and HPI community is, right? That it spans West Asia, East Asia, South Asia, Southeast Asia, Pacific Islands, the Native Hawaiians, all of their diasporas, all of the languages that are encompassed in these regions, all of the religions, all of the ethnicities, the races, the beliefs, and so on and so on and so on. And because of all of this diversity, a piece of data saying, that X% of AAPIs experience domestic violence, I would say it's not super meaningful, just like saying, the statistic that we're always pulling out, the annual mean income of the AAPI community is 80,000 or whatever it is. I don't know if it's actually 80,000, but that just obscures the very big group of AAPIs that earn below the national average. Because you're using this broad statistic to refer to the entire diverse group. You're obscuring those who have more of a, like a real and pressing need. And so we know from our work, because of how much silencing and stigma there is that is associated with domestic violence, reporting is very low, reporting of violence, and that doesn't mean the prevalence of abuse is low. And so one of the biggest needs consistently is data, robust disaggregated data on how abuse shows up, where it shows up, what survivors need, where they're turning to for help, why they're not turning to anyone for help, what does that process look like, what happens when they turn to people for help, and so on. And data is something that's important for programs, to inform program design, so where the money and the resources should go for funders, and for policymakers. And data is also important because it's a tool that we can pull out and say, look, here's this community, there's this need, this is why we need resources, and this is why we need to be paying attention to this community. And in particular, we need to intentionally focus on those that are being left out of the data picture, So that includes Pacific Islanders, Native Hawaiians, refugees, elderly survivors, youth, Muslim communities. It's obviously not an exhaustive list, but these are just some that came out of our sessions. Parallel to this is the challenge that AAPI histories and experiences are not part of the mainstream culture. They're not taught regularly in schools. They're not part of the curricula. And this contributes to the othering that happens to our communities, where many Asians and Pacific Islanders still feel like they're foreigners, even if they were born in this country, even if they grew up in this country. And so lastly, this orange quote here comes from a listening session participant. And it gets at the difficulty of data collection and the challenge of building trust with the community. So when you're coming into a community and doing research, a lot of times we've heard it can make the community feel like, you know, a researcher, educated researchers coming down from his Ivy Tower to, you know, kind of mine the community for information, use them for information, and then they just leave, and, you know, the community never sees anything come out of that data. Nothing is ever given back to the community. So that is an additional challenge. In terms of what's affecting AAPI organizations, especially smaller organizations, and I think this isn't, you know, just limited to AAPI organizations. I think it's something that's that we've seen across the board, just in our movement as a whole, particularly during the pandemic. So, you know, to put it bluntly, a lot of organizations are having a really tough time in the pandemic, and, you know, not just due to the pandemic, but things that have been going on before the pandemic and just haven't been tended to before. Staff are very burnt out. They're suffering from secondary trauma because of what they're hearing from survivors, the stories of abuse, and what's happened to survivors is affecting advocates. Advocates feel isolated from each other, particularly AAPI advocates. I've heard many say, you know, I'm the only AAPI person on staff. Nobody else really understands where I'm coming from. I feel like I'm the one that's called in to do all of the diversity work because I'm the diversity, you know, person, even though I'm just hired to do, you know, some other unrelated work. You know, a lot of AAPI advocates have had a tough time balancing both their own emotions and their personal reactions to anti-Asian hate, or anti-AAPI hate and what happened in Atlanta. So a lot of folks feel like, you know, they need to represent and be an advocate, but are still struggling with, you know, what am I feeling, my own personal emotions, and where, you know, the challenge between being an advocate and just being a person, right? And not getting a lot of support around that. Leadership. So this includes both high-level leadership, executive directors and directors, and mid-level leadership, managers, for instance, need support and training, how to manage, how to be a supervisor. A lot of folks have been thrown in, maybe thrown isn't the best word, but have been raised to leadership positions or hired in leadership positions, and are still expected to do a lot of programming work, more programming work, in fact. But on top of that, they need to do now their managerial work, and don't have any support or training around that, which contributes to burnout and capacity issues. Boards, some boards, to put it gently, tend to be a little bit more conservative. They may lack understanding of why we can't do gender-based violence work without doing racial justice, reproductive justice, you know, justice work. The boards might be resistant to programming. Boards may need training to help them kind of understand that connection. Many organizations in this time are struggling to do culture shift, a great thing, you know, to become more transparent, to become more accountable, you know, but it doesn't just happen because you want it to, right? It takes a lot of staff time. It can take a lot of consultant time, funding, and the same thing with work, same thing with organizations going through transitions like API-GBV did last year. We know firsthand that while you're figuring out all that comes with the transition and all the planning, strategic planning, learning, the work doesn't just stop because the transition is happening. So balancing that becomes a huge strain on organizations. Many community organizations have felt more connected to each other through the pandemic, but there is still the need to bridge that distance for advocates across the country to kind of come together, network and share strategies to break down the isolation from the pandemic. The fact is, there are people in this movement, and everybody in this movement care, and we want to make a difference, but a lot of folks aren't staying in this movement. Maybe they're burnt out, maybe they don't have the capacity to keep going, maybe they're frustrated at what they've seen in their organizations or in the wider movement. Maybe it's a financial choice that they had to make, balancing the financial stability of their family versus doing work they care about. But this is something that's real and that we've seen over and over again from our community, is that we really need to take time as a movement to tend to the people of this movement, build a pipeline for future leaders, make sure advocates are supported and feel empowered. And again, I'm not just speaking for the AAPI community here, but I think this probably resonates outside of the AAPI movement as well. I'm gonna pause to see if there's any questions. I have a question in the chat about the term gender-based violence and why we use the term gender-based violence. So apologies for not maybe doing a little bit of like terminology, stop to explain some terminology in the beginning. There's a couple of different definitions of gender-based violence. It's not a perfect term, as a lot of us in the movement have acknowledged, but we use gender-based violence to refer to harms and abuses where the person who is the target of the harm or the abuse is a target or is vulnerable because of their gender, and whether that's being a woman or a girl or a man, or a gender non-conforming, non-binary person. These people can all be targets, be victims of gender-based violence because of their gender. So for instance, domestic violence and sexual assault, we consider forms of gender-based violence, with the person being targeted because of their gender. Hope that answered your question. Let me know if you want some further clarification. Okay. So coming to some challenges we've seen related to kind of the dynamics of abuse, or just domestic violence, sexual assault, how trends are showing up from the pandemic. I think it's pretty common knowledge now that shelter in place has complicated abuse situations. There's more cases that can be classified as severe than there used to be. There's more survivors needing medical treatment or hospitalization as a result of the abuse. And there's more survivors that have needs that fall out of the strict, protection order, safety planning. If you're looking at the narrow definition of a domestic violence needs, there's more survivors who have needs that fall outside of those. So they may need transportation related assistance. They may need more economic help, as a result of the pandemic, and other such things. There seems to be more issues with mental illness and suicidal ideation, particularly among AAPI youth, which may be related to the fact that many of them have moved back with parents, because of shelter-in-place policies and virtual schooling and virtual work. There's unfortunately still a lot of stigma associated with mental illness and substance abuse in AAPI communities. And some AAPI children are victims of family violence, controlling relationships, forced marriage, which shelter in place would have exacerbated. A lot of children, or, I say children, but I mean like young adolescents, have had very controlling relationships with their parents or their other family members, or been targets of family violence. They have since moved out of the house for school or for work, but have had to move back in during the pandemic. There seems to be an uptick in reports of violence from somebody outside of the home. I mean, violence at the hands of somebody outside of the home. So somebody at work or on campus, or faith leaders, for instance. On the other hand, the sources of where reporting used to come from are more disconnected from folks, or I guess I phrased that a little differently, meaning a lot of reports of violence used to come from teachers or club leaders or nurses, folks who would be in contact with children or survivors and say, hey, I noticed signs, something may be happening. Because, these people, teachers and nurses, are having less contact with patients or clients now because of shelter in place. And, we can see this quote in the bottom where advocate is saying a lot of children in their community can't be found. They're not going to school. They're not, so you assume that they're, doing homeschooling or virtual schooling, but the truth is you may not know. And while Zoom and Google Meet have simplified a lot of things for our work, there are a lot of people who don't have the same access, right? Or they don't use Zoom or Google Meet. And so we need to understand how the tools that our communities use, what are the safety protocols around that? How do you keep abusers out of, for instance, WhatsApp or WeChat, or the QQ, I think, is another one that is big for the Chinese community. So we need to understand, what are the confidentiality and safety privacy issues in these apps as well. And obviously, there's been kind of a national focus on AAPI hate after what happened in Atlanta in April. But AAPI hate is something that's obviously not new, right? Our communities have experienced AAPI hate and othering for centuries. For the entire time that our communities have been in the United States, we have been the targets of hate and harassment. And because of the incidents, the maybe increase of incidents during the pandemic, though, a lot of AAPI survivors feel more anxiety or fear that stops them from reaching out for help to law enforcement or to services, because they feel like they're going to be judged, or they feel like they're going to be the targets of harassment, or they're not going to be safe, right? So the AAPI hate is really something that's becoming a barrier to survivors as well. Something that we asked during the survey and the listening sessions is, which groups are you having? Oh, that's this slide. Let me go back, actually. I included this quote in here. This is not from a listening session. This is from a report that we did with the Texas Muslim Women's Foundation back in 2020. But even though this quote is not from the listening sessions or the surveys themselves, the reason I included it is because I think it's a great representation of how, not just during the pandemic, but even before the pandemic, AAPI survivors face multiplicities and layerings of harms, of needs, of challenges. So I'm just going to read this quote. It says, "I grew up with violence. My father hit my mother. My grandfather hit grandmother. My brothers abused their wives. My sister was abused. I was supported by my female family members until I reached out for help. They said I was betraying the family honor by reaching out. If I go back to my country, my brother will surely kill me. I was married to my first cousin. So, you know, I think the quote kind of illustrates how challenging the situation can be in AAPI, you know, families, because you have one's own family member supporting the violence or condoning the violence, or, you know, saying that you're in the wrong for reaching out for help. You have the issue with, you know, the two countries, you know, wanting to go back, but not being able to go back. It seems like this person may be a survivor of forced marriage. You can see the generational aspects of abuse, where abuse becomes, you know, so deeply rooted in the community that it's normalized. Right, so just to illustrate some of what our communities are facing. Let me look. Okay, let me address this question at the end, and then, yeah, let me move on to this slide. So, you know, we asked folks, which groups are you having difficulties reaching out to in terms of services or in terms of outreach? Here are some of the groups that are showing up in responses. So Pacific Islanders and Native Hawaiians, always consistently, right? There's a huge need to serve these folks that are constantly being underserved and being subsumed within the wider AAPI umbrella. Elderly survivors, these are the folks that are more likely to be in need of language support. We've seen greater LEP, limited English proficiency rates among elderly survivors. These folks are less likely to go outside of the home or go to an agency for help for something that happened to them. You know, many of them are staying home because elders, seniors have an increased risk of COVID. And there's been so many news reports of AAPI elders getting attacked, getting pushed, getting robbed or mugged on the streets of, you know, the city, and related to AAPI hate. And so this is making a lot of AAPI elders less likely to leave the home to reach out for help. Immigrant survivors and undocumented survivors, many of these folks have cases or situations that span 2 countries, 2 systems. Many of them are in need of family reunification. They may be victims of their abuser getting in the way of them getting documentation. There's a lot of fear still of the immigration enforcement system, fear of getting deported, you know, coming out of things that we've heard, situations at the border. Children impacted by domestic violence or trauma in their home. LGBTQIA or gender nonconforming, queer and trans AAPI survivors, who are very frequently still made to feel like there's more safety with their partner, even if that partner is abusive or controlling, than with their family member or with their community, because, you know, from what they've experienced, their family and their community has been a source of attempted conversion, of ostracization, of shame, and so on. Deaf and hard of hearing survivors, on top of the challenge of finding interpreters, you know, ASL interpreters or non-English sign language interpreters, such as Korean sign language interpreters, can be a very small population, and so can be hard to find qualified ones. Aside from just that, you know, more logistical challenge, there's still a lot of stigma and shame around being deaf and hard of hearing, or, you know, living with a disability coming out of the community, which means that the community is invisibilized and still underserved. Agencies do their best with referrals to different agencies and using the trust they've built within their communities over a period of years. But we are hearing that there is still a lot of unmet need with each of these groups. You know, agencies need funding in order to meet these needs, and they need training in order to develop the capacity to build to meet these needs. In terms of outreach, there is a similar story. Some communities aren't being reached because they may not speak, or they may speak a particular language that's hard to find interpreters or translators for. And so the local agencies aren't able to translate their flyers or find interpreters for their videos, for instance, or find interpreters for Zoom calls. Some folks in the community, they may not have access to technology or high-speed internet, or even medium-speed internet can be spotty in certain areas, rural areas. So we do need alternatives to phone, email, and Zoom, and to, even though it's simplified a lot of our lives, to not be completely reliant on these, because it's not the way to reach all survivors in all communities. Certain groups like faith leaders or community elders, these are the folks that are so important in the lives of survivors, but they may see our movement, the anti-violence movement, as a challenge to traditional values. They may see our movement as wanting to break up families. And so building trust with these groups does take a lot of time. And especially when we add on the lens of, we're working towards racial justice, we're working towards reproductive justice, economic justice, it can become a further kind of challenge in reaching some of these more traditional groups. When asked, do you think your communities are ready to have conversations about these topics? Many advocates responded like this quote on the slide. Much of our community is not ready to talk about racial justice issues yet. Some see wokeness as a challenge to family values. The work ahead is to broach these conversations with them. So it is, a long-term process. In the minds of some communities, some individuals, these concepts are things that may not apply. They don't apply to you. They're Western concepts. We just need to keep our head down and focus on our own family, our own selves. Some folks may even be resistant. There's still a lot of prejudice, a lot of anti-Blackness, isms, ableism, elitism, colorism within AAPI communities. And so we've been hearing from community-based organizations. They are struggling with not wanting to push too hard to start these conversations, because then you lose the trust of the community, but still knowing that these things are important and that you need to push a little bit, but where's the line? And of course, balancing all of this, all of what I just said, with full caseloads and still needing to put out immediate fires. So I've heard somebody say, our staff is struggling with doing their work, but also being an advocate, being an activist, and being an ally. Okay, so I am going to now pass it to Cannon.
Hi. So
Yeah.
we're going to talk a little bit more about some of the issues, and obviously because I'm the language access person at API, I get the language access slide. Thank you, Shirley. So language access continues to fall short of survivors' need, particularly in languages of lesser diffusion and in rural areas. But we do know that languages in our API communities are very difficult to come by, right? In terms of the resources that are provided. Most API languages do not rise or reach the threshold for interpretation or translation, right? So when agencies are looking at and they're planning, whether it's your agency, whether it's local government, state government, when they're planning their language access plans, what they do is they look at data, they look at their census data, they try to figure out what are the largest LEP populations. And most often the languages, API languages, aren't going to be captured there. They're not going to rise to the level where organizations, governments will say, yes, we need to build the capacity to provide interpretation and translation in these languages. LEP survivors are left out of virtual services, public releases of information. So what we know with COVID is a lot of information went out advising people how to access assistance or services. What we know also is that these systems weren't prepared to provide assistance in API languages. So this is something that we repeatedly heard where advocates and clients, LEP clients, were contacting local government because they needed rental assistance. And what they would do is they would call, and like everyone else, they would be on hold for 4, 5, 6 hours. When they finally got through to somebody, if they needed an interpreter wasn't available. You could not get an interpreter in Vietnamese, in Hmong, in Chuukese. If you requested one, they would put you back on hold and the call would get dropped. Or in turn, you had to get off the phone because you couldn't spend another 6 to 8 hours being on hold. So we know that the system of response wasn't prepared to provide the information that was needed. Another thing that frequently has been reported is that LEP victims and survivors were not aware that services were available. So when the stay-at-home orders were released, information was being provided, but that information wasn't being translated into API languages. So how, if the restraining order clinic or protection order clinic was still open, our communities didn't know that it was open. And if they were aware it was open, they were not given instruction on how to access those services. Interpreters, and we're going to talk a lot about, or just a little bit about access to interpreters. Interpreters prefer to work in court, so very frequently, the most qualified interpreters prefer to work in court. What ends up happening then is they're less accessible to DV agencies. Also, the lack of qualified interpretation. So I've been doing this for over 10 years. We continue to provide trainings for interpreters on domestic violence and sexual assault and trafficking. And I have yet to do a training for interpreters, for court interpreters, where when we're talking about domestic violence and we're talking about sexual violence in an interpersonal relationship, without fail, there's always at least one interpreter who will say a husband cannot rape his wife. We continue to hear stories from advocates when they're using interpreters, both in-person and telephonic interpreters, where the interpreters are telling the survivor, you can't leave your husband because you will bring shame on the family. So these challenges continue to exist, and there needs to be work done at a systems level to build the capacity of communities to provide the appropriate level of language access, and not to solely rely on the bilingual advocate or the multilingual advocate to go to all of these spaces and serve as an interpreter, because that's not what they're trained to do. That's not what they're qualified to do. Next slide, please. So challenge is economic. The pandemic has exacerbated existing economic disparities affecting API communities, and many survivors continue to be left out of the remedies. Barriers accessing loss of income support, victim compensation funds, stimulus checks. Once again, for a lot of our communities, knowing how to access these services, getting this information, but not having the forms translated so they can understand how to apply for and receive these funds and support. Long processing times for benefits. Survivors are unable to support their children and families while they're waiting for the benefits to be processed. Immigrants working with work visas who have lost their jobs may be unable to retain their status. And many middle-income survivors can't afford attorney rates, but don't qualify for legal aid. Another thing that has come up that we've been made aware of is where batterers are contacting legal aid so that about the case, so that the survivor, when they contact legal aid, they're conflicted out, so legal aid can't actually assist them even if they do qualify. So access to attorneys has been a significant challenge, not just in providing assistance in receiving restraining or protection orders, but more broadly, the multiple areas that our survivors are encountering the courts and seeking assistance. So family law, child support, child custody, these are all areas where attorneys are needed, but our survivors have a lot of difficulty finding that legal assistance. So system challenges. Systems still often lack training around AAPI issues and needs and frequently re-traumatize survivors. Complex systems are a barrier to survivors and generate distrust and fear. A lot of our survivors come from systems where the government and the systems that are in place are complicit in the abuse and violence that's perpetrated against them. And so when they come here, what's the first thing that they see? Particularly now, the rise in AAPI hate, the vitriol that is directed towards AAPI communities and individuals. And in turn, when we tell them, hey, if you need help, go here, go to the restraining order clinic, contact law enforcement, what happens when they're not able to communicate because an interpreter or someone isn't there that's available to speak in a language they understand? Long wait times put survivors' cases and lives in limbo. This has been particularly exacerbated by COVID and the delays that we've been seeing in courts and the request for protection orders and restraining orders. And in terms of having those hearings before a judge, the transition to virtual hearings and has impacted and delayed a lot of cases. And we're hearing reports that a restraining order, protection order hearings have been postponed several months. And in the case where an interpreter is needed, we've heard that those cases in some courts aren't even being heard because the courts are not equipped to provide interpretation remotely. And that ties into the lack of language access, transportation, childcare limits, access to criminal justice remedies. Uneven application of prosecutions leave victims without justice, especially when abusers are prominent in the community or hold positions of power. Agencies are exploring community solutions beyond law enforcement and the criminal justice system. And so in turn, when agencies have explored alternatives to law enforcement and criminal justice systems, what's happened is that there has been a backlash from the criminal justice system against these agencies. And in one particular instance, a shelter had posted support for the Black Lives Matter movement. And as a result of that, their local law enforcement refused to assist them on any of the DV cases or calls that they were receiving. So there definitely is an impact when agencies looking at the systems and how the systems are not responding to the needs of our survivors and trying to figure out ways to respond and provide services to survivors, how systems can have a negative and how negative reaction and how there can be negative repercussions against these agencies. And these are agencies just trying to serve their communities. Next slide, please. Funding is scarce, restrictive, and frequently cumbersome to manage. We continue to face challenges around funding. There's a disconnect between what AAPI communities need and what funders think AAP communities need. We frequently encounter this where solutions are model-based, and people think that if this model worked in this city, for this community, we should just be able to take that model and apply it to our communities. And once again, thinking that AAPI is just some monolithic single group that speaks one language that has the same cultural history and beliefs and practices, right? So we face that challenge, and a lot of that is why so many advocates and we as an organization are looking to try and disaggregate the data around our AAPI communities. Base practice when we're talking volunteers are doing behind the scenes, because a lot of time the work that's being done can't be published as a report because the information could be endanger the advocates or the survivors. Managing grants is very demanding on staff time. We're constantly writing reports, we're constantly tracking our numbers and making sure that we're following all the information and providing all the details that's needed to ensure that we're in compliance with our grants. I would say a good maybe 40% of my time is just managing grants and all the reporting requirements tied to those grants. Loss of individual donors during the pandemic. One of the things that we're acutely aware of is that funding for donor funding is cyclical. And so depending on what is happening in the world, we can't always rely on donors providing the funding to support our services. We saw an increase in funding for API programs and API servicing programs after the murders in Atlanta, but subsequent to that, we aren't seeing as much funding and outreach for funding for AAPI direct service providers. Funders are always big on innovative projects, but we're just here trying to put out the fires. That's one of the comments that was provided in our listening sessions. Another comment was we need education of funders who perhaps are still basing their funding and expectations on white-led models of intervention and prevention.
Thank you, Cannon. So I don't think there's any outstanding questions, so I'm going to move on. Oh, shoot. I had to turn on my camera. Okay, so I'm going to move on to recommendations. You know, so I think it's been clear that as Cannon and I spoke about some of the needs and some of the challenges, how these needs and challenges can be translated into recommendations, right? But just kind of rolling some of them up into the next slides, just a couple. So, you know, I've said it, Cannon said it, we need to commit to disaggregating AAPI data, AAPI histories, experiences, and needs, recognizing that all of our needs are not the same. How different communities and those of different identities are impacted by violence, how cultural practices can be woven throughout services and support. And so, you know, what that means is that organizations need training, they need funding on how to collect data. One great way that we've, you know, we recommend always is community-based participatory research, which really centers the community as the leaders, as the experts of their lived experience, and as the ones who are able to collect the data, giving them the tools, the you know, whatever they need to collect data on what happens in their communities. And of course, again, you know, that's something that needs funding and that's something that needs training too. Things that'll really help, you know, package our needs and bring them to the funders. We need to invest into engaging with faith leaders, community elders, and other trusted leaders. And so, for instance, in the Korean Christian community, this might be pastors or church deacons. In the Hmong community, this might be clan elders. You know, different communities may have different institutions, community institutions of leaders, and those who are supposed to be providing guidance to you if you're having like a relationship issue or a family issue. You know, these are people that the community trusts. These are the people that the community go to. And so if our movement doesn't engage with these people, then that's a big opportunity that we're missing. Of course, it's a very long process. And the consultants we've worked with to do some faith-based engagement work, what they're telling us is that the leaders are willing. They want to learn about domestic violence issues. They want to know how to help survivors and how to, end domestic violence, but they do need more support. They do need ongoing support and training in order to do this. We, as organizations and advocates, need to learn how to operate within an anti-racist framework, which prioritizes addressing AAPI hate and disparities. So, prioritizes addressing AAPI hate and disparities means not treating AAPI hate as kind of an add-on, as an afterthought, right? Like, oh, we need to include the Asians and the Pacific Islanders too, but really holding it as one of the central central harms, central things that we need to eradicate. What this means also is recognizing that AAPI women and girls are targets of not just AAPI hate in a racialized way, but also in a gendered way, targets of objectification and fetishization. And this, this is something that comes from non-AAPI people. Non-AAPI folks, but then also from within their own community, the AAPI community, they're also targets of gender-based violence. And so really honing in on the intersections of racialized and gender-based violence. And that's a focus that we've seen even as AAPI hate has risen to the national attention. That's still something that's often left out, is that intersection in particular. And we need to bridge connections between advocates and organizations across fields and sectors, recognizing that our movement can't work in a silo, that we need to work across movements, across communities, building partnerships, for instance, with racial justice movements, like I said, with public health, with reproductive justice and economic justice movements, civil rights movements maybe, that our AAPI communities need to work with Latinx communities, with the African American community, Indigenous community, right? Because these are things that are all woven and tied together. In terms of organizations, one recommendation that's been given, or that we've heard in the sessions, is to bring older immigrants into the movement as advocates, because these are the folks that have the connection to their communities and have the trust of their communities. Prioritizing staff care, trauma, and well-being. This includes all levels of staff, from the entry-level positions all the way up to the executive director and even the board. I think a lot of times the higher leadership and the board are maybe left out of the, prioritizing their care and the trauma that they may be experiencing. Building in time and budget to evaluate organizational policies and structures to make sure that there's equity, transparency, and accountability. We've worked with an amazing organization in Texas Muslim Women's Foundation in Houston. They had a project where they evaluated their organization to infuse a culture of trauma-informed care through not only their programming and their services for their survivors, but also for their organization and their staff. And it was a really long process that took over, spanned several years, but it's so important to do this work for long-term organizational sustainability and to address not only your programming, but also your organization internally. And then this last bullet, so one tip that we did pick up in the listening sessions was that a narrowly focused caseload might contribute to burnout and secondary trauma more. So an advocate basically shared with us that their sexual assault staff at their organization was experiencing a lot of turnover. And so that made them kind of reflect and restructure their organization so that all staff now carry a diverse caseload, which seemed to alleviate some of the burnout and some of the turnover. So, that could be one maybe more tangible tip or, something to at least think about. And, just overall, like I said, recognizing that the work is important, but advocates are just as important. Cannon, what are your recommendations?
So some of the recommendations related to systems and funding, prioritizing language access across all systems, including for languages that aren't commonly represented. And really with that is building capacity and building the capacity to provide services, particularly in API languages, which there aren't a lot of resources, and API is doing a lot of work on building the capacity of communities to have qualified interpreters that are trauma informed. Funders need to encourage collaboration amongst organizers, organizations, and between community agencies and systems. And part of that really is for us to get out there and educate funders on what we as API communities need and what we as direct service providers are doing to serve our communities. There's not a lot of knowledge there. It's also reaching out and encouraging communities and donors in the API community who might be willing to support our programs and organizations. Funders and systems should support intersectional approaches and recognize broad definitions of harm and well-being. And that really goes to helping funders and systems kind of get out of that, remove that mental block where they view systems, they view our survivors and our communities within a framework, within a framework which they understand, which very frequently is the framework that's been adopted around white survivors and the community here.
Thank you. Yes, very important. So, this is where I got stuck a little bit, to be honest, because if you followed our work and our webinars, if you are an advocate who organizes in the AAPI community, or if you're just familiar with this work at all, you probably have recognized that a lot of what we've said is not new, is not groundbreaking. We tried to keep it to trends that have really been emerging more in the last year and a half, things that have come up in the listening sessions, things that have been exacerbated in the last year and a half, maybe because of the pandemic. But, a lot of this is stuff that we've heard over and over, that we've been, telling people for years that have not seem to change, too much, in that they exist, right? Their existence has been around for years, which leaves us kind of with the hard question of, like, so now what? What do we do? Why does it feel like sometimes we're just on a never-ending hamster wheel, rehashing some of the same problems, trying to raise some of the same concerns that we've had for years? So, I don't really have an answer for you. I don't know if Cannon has an answer for you, but I think I can take this time and share some of the upcoming projects and initiatives that we have coming out soon at API-GBV, that we really kind of designed in order to address some of what we've heard in the listening sessions. So firstly, in the next week, or in the next couple of weeks or so, we will be releasing the first episode of our podcast, which is called The Village Podcast, hosted by Puna Levinson, who is actually, I just looked in the attendees today. So this podcast is really aimed to explore the points of connection and opportunity between our field, what we do, and parallel fields. Like I talked about before, really wanting to explore how our movement connects with other movements. Starting with the public health field, which is the feature of the first episode, and then the response to COVID-19, and the effort to get information out to Native Hawaiian and Pacific Islander communities. Really centering that kind of that intersection. So the episodes of the podcast are pretty short and they're pretty digestible, but we hope it's a starting point to be able to explore some of the connections. So in this podcast and then the next project that I'll share that I'm super excited about, we are really attempting to center the Pacific Islander population because they've been left out of the dialogue time and time again. So in the next project, we gathered elders, faith leaders, and other trusted community members within Pacific Islander communities to reconstruct the power and control wheel, which I think we're all familiar with, in a way that reflects Pacific Islander experiences. And that's something that goes beyond just translating the terms, but also means exploring how violence shows up in these communities. What are the lived experiences of Pacific Islander and Native Hawaiian survivors? And the other thing is, by involving the key community members, we're able to explore how we're able to hold open conversations around violence, which, as we know in this work, is so important to breaking down the stigma. So, super excited about that. And also super excited about the potential to kind of scale this in different communities as well. Another project that we've been working on that I did reference earlier is working with faith leaders in different communities to train them to respond to violence in their congregations, which again has been a very long-term process of building trust and relationships. But we're excited to grow that project. And then some of you may know of our bi-monthly Bridges virtual connect calls. These are us trying to hold space for AAPI advocates to kind of come together and connect and break down some of the isolation, some of the, just the isolation that comes with the pandemic, recognizing that people are all looking for ways to connect with each other and to be in space with each other, and hopefully address some of the burnout issues. So I don't know if Cannon, if you had any initiatives you want to share, or just reflections or tips, anything like that, putting you on the spot.
So we are hoping to do use some upcoming funding to get some data on AAPI communities and in the United States and territories to try to start disaggregating the data that we have. The other thing that we are working on is we just recently piloted a 40-hour web-based training on trauma-informed community interpreting skills building. And so we are hoping to offer that as a training course for bilingual advocates sometime towards the end of the first quarter of next year or early second quarter next year. So please look in your email boxes in the beginning of next year, early next year, as we are going to offer that as we're going to be accepting applicants for this training course. In terms of reflections, it really has highlighted recently, and particularly in the work that we've been doing with our Native Hawaiian and Pacifica communities with the translation of the power or recreation of the translation of power control wheel, is the limitation that's placed on us by funders and how they view us and how they view the services that we provide, and whether or not it's in alignment with what they think our communities need and what what we know our communities need. And so I think that we need to start doing some thinking around how to start messaging and communicating to funders that they need to broaden their understanding of what direct services needs to look like. And then in addition to that, I think also there was, after the murders in Atlanta, there was an initiative, and I believe it was started by some former Yahoo executives to fund, to bring together AAPI leaders, business leaders, to start funding programs to support AAPI. I think we need to continue to look at how we can engage our business leaders so that they can start supporting our programs. I think that's kind of one area that we've kind of missed. We've looked towards the federal government. We've looked towards large foundations like the Gates Foundation to fund our programs and to meet the needs. But I think that we need to start looking to our own communities and our business leaders in those communities to try to get them to start working with us and supporting us. That's just you put me on the spot and what I came up with. And if you disagree with me, Shirley, you can just you can turn my camera off and boot me.
I know I did put you on the spot. I'm sorry about that. But those are great recommendations and reflections. Yeah, I think that is the corporate partners, right? I think that's like a missed opportunity and a big opportunity for us, especially because, you know, we need to start packaging our movement as something that everybody should care about. You know, even if you're not doing this work, it's something that you need to care about because it's something that reflects or impacts all of us. I was answering a question earlier in the chat about how a lot of men aren't involved in this movement because it's still treated like a woman's issue, right? But it's not a woman's issue. It's just a human issue. And so in the last couple of minutes that we have, I just want to open it up for any questions in the chat. If there's something that you want to know more about or anything like that, I'm gonna shut up for a couple of minutes and see if there's any questions coming in. I don't see any outstanding questions, I think. So if there are any other questions, I'm going to put my email in the chat. And if you do have questions, you can always reach out to me separately afterwards, or if you just want to get in touch and you know, learn more or share what you're seeing, what you're finding, or you know, just chat or anything like that. Also, just put the slide back up where you can see both mine and Cannon's emails. So let us know. And other than that, thank you so much for you know, being here today and learning about what we're finding, learning about the AAPI community. I hope that this has been helpful, and I hope that you're able to carry some of this into your work or into your studies, wherever you may be coming from. And with that, I'm going to close out. Thank you so much and have an excellent Thursday. Take care.